Hi dear parents, today we'll learn something about Herpangina, a viral disease which causes fever and mouth ulcers in kids. I'm Dr. Tejashwini, consultant children and newborn specialist from Pebbles Pediatrics, Kondapur, Gachibowli. So this Herpangina is caused by a virus called Coxsackie virus. And the main symptoms in this disease are fever, mouth ulcers, body pain, stomach pain, the kid being very irritable, sometimes accompanied with cold and cough. How does it spread? It spreads from kid to kid through droplets, through hand-to-hand transmission using the same utensils, same water bottles and same cutlery by the kids, and through droplets. That is when they sneeze or cough, the droplet infection also helps in spreading of this virus. Coming to the management, like in any fever, we give fever medicine such as paracetamol as and when required. That is when there is fever, according to the weight of the kid, the dose will be decided by a pediatrician, which can be repeated once in 6 hours and once in 4 hours if needed for a dose of 2. And the most important thing here is hydration, because the ulcers are too painful. Imagine the ulcers we get on our lips, the regular mouth ulcers. These ulcers are present on the roof of the mouth, in the throat of the kid, and they're multiple and they're quite painful, which causes swallowing very difficult. They are so painful that they are not able to swallow their own saliva. So obviously they refuse food, including solids and liquids. Even taking sips of water is also quite difficult for the kid. So we need to ease the pain of the kid through oral medicines and also through some gels which can be applied locally on the ulcer area to decrease the pain of the kid. Coming to the hydration part, because they are going to refuse all forms of food, both solids and liquids, they are going to be dehydrated. So give something which is cold, like an ice lolly, custard, ice cream. Yes, ice cream also, because it helps in easy swallowing and also it helps in reducing the pain locally for some time. Apart from that, there are other diseases also which can cause mouth ulcers in kids. So you need to consult your pediatrician who will have a look at the throat and examine the kid and decide whether to add any other medicines or stick to the basic hydration and local pain relief medicines. So what are the precautions we need to take? This disease is usually seen in young kids, aged between 2 to 5 years. It's not that it doesn't happen in older kids, but usually seen in this young kids. So when your kid is sick, please don't send them to school. Make sure your kid hydrated. Count the number of times they are going to pee, because that is an indicator of hydration. Consult your pediatrician as early as possible to look what can be done, what precautions need to be taken, how further management is needed or not. Usually this disease is self-limiting, and after the initial 2 to 3 days, the kid gradually starts to take his food, the fever comes down. The total duration might last from 5 to 7 days, after which you can send the kid to school. But during the first 5 to 7 days, it is important to take care of the fever and the liquid intake of the kids. There are few dreaded complications like meningitis, in which the brain is affected, which is a very rare complication. Most of the complications come from the kid being dehydrated, not passing enough urine, and that's when we need to give him the fluids through IV. This is what we want to avoid. So keep giving few sips of liquids every 10 or 15 minutes or so. Keep offering liquid milkshakes, custards, ice cream, ice lollies. Keep the water in fridge for some time and keep giving the sips of water, which the kid might be able to take a little better. So if you have any queries, please feel free to contact us on the given number. A tip for all the parents out there, please don't give any screen time to your kids who are below 2 years of age. For above 2 years of age of kids, restrict the screen time, that is including your iPad, talking to your grandparents through phone, the TV, everything together, restrict it between 1 to 2 hours maximum. This would help in the development of the kids. Giving a lot of screen time hampers the development of the kid and also causes speech delay. Take care.